Okay, so then the adrenal cortex. So again, remember, if you have a cortex and a medulla in an organ, the cortex is the outer of the two. The cortex is the more outer region. The medulla is the more inner region. So now we're looking a little more superficial and outer. And hey, does this look familiar? So remember when I talked about the hypothalamus triggering the release of CRH? That tells the pituitary endocrine cells to make ACTH. Yeah, so all of this. And what we have here, cortisol. So cortisol is another hormone that we covered that is secreted by the adrenal glands. Now, is it just epinephrine, norepinephrine, and cortisol? Is it just the hormones we covered in the general adaptation syndrome? Nope, there is more, so we're building upon that. So the interesting thing is that cortisol belongs to a general category of steroid hormones we call glucocorticoids. Now there are other ones like corticosterone and cortisone, and they're made by this subregion of the adrenal cortex. So this is where it gets even more complicated. So I start you off simple and I build upon your knowledge, and you'll see me doing this a lot because some of these topics, there are a lot to take at face value, but if you start off simple and build upon it, it gets more accessible. So this is actually all adrenal cortex as I'm indicating here. But there are three subregions and they make different sets of hormones. So the middle region of the adrenal cortex, the zona fasciculata, it makes glucocorticoids, and cortisol is one of the major glucocorticoids. Now what do they do? So this is cortisol. So there are many effects of cortisol. Cortisol is a very powerful hormone. I think I saw some pack-back questions regarding that. And oh yeah, and if you're just signing up for pack-back this week, okay, you gotta get on it because you still can get the max points, but there's 14 weeks left, so don't miss too many weeks if you haven't signed up for pack-back yet. So there are some questions that mention cortisol. Oh, and if you haven't signed up for a group for pack-back yet, just choose one at random. They're all pretty evenly seated right now. Okay, so back to cortisol. So cortisol, very powerful and many effects. It increases your blood glucose and actually affects your metabolism of glucose in your whole body. It also involves fat metabolism. So cortisol, very important in nutrient metabolism and how you process nutrients as well. And this is one of the major effects of cortisol. It's anti-inflammatory. We haven't covered inflammation in detail yet. We'll cover inflammation more when we get to exam 3. But this is what it does in general. In general, it lowers your immune system. So if your immune system is out of control, well, what happens is that cortisol can help dial back, tell your immune cells to kind of take it easy, so it kind of lowers their overall activity. But again, what if you want to defend against diseases and you have a lot of cortisol? Well, that's going to make it a lot harder to mount an efficient immune response. Now, cortisol is chemically the same as hydrocortisone. You might have seen this in the drugstore. I'm not advertising this particular drugstore, but again, what we have here, hydrocortisone cream. And why might you take it? Well, when you have itching, you see swelling with the itch. And the allergies are triggering triggering an inflammatory reaction. That's why you have it gets red, it gets swelling, it gets itchy. So the hydrocortisone, by applying it, it helps to kind of alleviate those symptoms of the inflammation you see with the allergy. So that's what we see there. And let's go back to top hat. So that was the chemical structure of cortisol. What type of hormone is it? It is one of these 5. Okay, let's see how everyone did. So most of you said steroid, and most of you are correct. Again, has the classic cholesterol, sterol backbone. What we see here are the 4 rings, and again, the 3 hexagons and the pentagon. Classic steroid structure, not like that tricky vitamin D. All right, let's go back to our PowerPoint. Okay, so then let's go. So yes, cortisol is a steroid. So it's and in general, this has kind of fallen out of use because steroids, they have so many effects. Usually they used to categorize them into anabolic or catabolic. So anabolism is building something up. Catabolism is breaking something down. So in general, cortisol and glucocorticoids break down tissues, but That's not like it doesn't apply to every single tissue, and there are little twists to it. But in general, it breaks down a lot of tissues. That's why in older textbooks, and I still kind of like this to like when you're starting out, it's useful to kind of think of anabolic versus catabolic steroids. But the more you study them, the more you find out there are subtle differences. But in general, it breaks down a lot of tissues. Now, then there's a related syndrome called Cushing syndrome. Not the same thing as Cushing's disease, which is a specific type, but what is Cushing syndrome? It's a form of hypercortisolism when you have abnormally high cortisol levels in the body. So what does that do to the body? Well, this is someone who has Cushing syndrome. And what do we see here? Notice that his face is very puffy, so that's a mnemonic. I know it sounds kind of mean, but I think of it. You get puffy like a cushion. So this is what you see with Cushing syndrome. So they actually say, yeah, that's one of the symptoms. Moon face, and then a buffalo hump that's mostly white adipose. It's mostly fat tissue. Osteoporosis, you have a bone right here, right? So osteoporosis, it gets more porous. It has a breakdown of the density of bone tissue. So cortisol is catabolic to bone tissue. You also have muscle wasting as well. Cortisol is also catabolic to muscle. And then you have obesity, you have also these stretch marks. That's what we have, these abdominal striae. And skin ulcers as well. So we have a breakdown of skin tissue and the connective tissue as well. So as you can see, there's a lot of breakdown of tissue happening with cortisol. So it also promotes adipose and fat tissue formation. And this is where the catabolic part kind of breaks down. Even it doesn't promote the breakdown of fat. It actually promotes this chemical process we call lipolysis. But overall, it stimulates the regeneration or actually the creation of white adipose tissue. So this is why it's not completely catabolic. It actually, like if you want to make, it's really cool. Like I think during my doctoral research, then when we were trying to make fat cells in a petri dish, like we add a glucocorticoid to help stimulate the production of fat cells to study. And that's why I say it's generally catabolic to the skin, as we see here, bone tissue, muscle tissue. That's why cortisol is a steroid. You can buy this steroid at the drugstore, but can you take a bunch of cortisol and hydrocortisone and get super jacked and ripped? Probably not. You're probably going to experience all of this if you take in sufficient doses. But yeah, oh yeah, these striae right here, these stretch marks. So again, we're seeing this kind of breakdown of tissue, but also accumulation of fat as well. And then there's something called Addison's disease. We're still on the topic of cortisol, but now we're talking about too little cortisol. So notice that hyper means like if someone's hyperactive, they're overactive, they're super active, whereas hypo means below. So now we're having below normal levels of cortisol, and many other names for it as well. So this is what we see, and like bronze pigmentation of the skin, so darker skin. This is a lady, but she now is growing a mustache, so a different body hair, gastrointestinal disturbances, all of these things happen. So even though like there's all this stuff like, okay, cortisol is a stress hormone, does that mean we should get rid of cortisol altogether from our body? No, look at this. So like all of these things are also negative effects of having too little cortisol in your body. So many hormones, you need just the right amount. Too much is bad for your health, too little is bad for your health. Also hypoglycemia, that's the medical term for low concentrations of glucose and blood sugar in your blood. Hypotension, we'll get to this more later on in the semester, but low blood pressure as well. Hyperpigmentation just means a darker skin color above normal. And actually look at this person's gums right here. Notice it's not the same color as their lips and the vestibule here and also the rest of their skin. It's really dark. So that's another classic symptom of Addison's disease. And this, yeah, JFK. So he had Addison's disease among many other endocrine diseases. And yeah, so it's very interesting. Like there's this article right here. And what they noticed is that, yeah, he was adrenally insufficient. So he was lacking all of these adrenal cortex hormones, including cortisol. And yeah, so he needed daily, every day he needed to be treated with cortisol, corticosteroids. That's the family that includes cortisol. And yeah, he needed to receive daily steroids to survive. So yeah, even if he did survive yeah, the assassination, who knows what would happen? Would he have lasted the whole term? I mean, yeah, it's like who that would be very interesting. I mean, or who knows? Anything could have happened. You saw Academy season 2. Crazy things could have happened. But yeah, he had Addison's disease as well, and he needed those cortisol. He needed additional cortisol to keep himself up. I think they also said he had needed testosterone as well because his whole adrenal gland wasn't producing enough hormones. All right, so then we covered that middle layer. The hormone I definitely want you to know is cortisol, and it belongs to, and is made by the middle region called the zona fasciculata. And glucocorticoids is a general family that includes cortisol. So the receptor for cortisol is actually what we call the glucocorticoid receptor, and it's actually the receptor for all of these as well, and hydrocortisone as well. So what we see here, many things as well, but cover, especially the stuff I cover in lecture, that's the ones I want you to know. And stimulated by that ACTH that we talked with the HPA axis.